It's time for our weekly visit from Dr. Zorba Paster.
We'll be taking your calls and questions in the next segment, so get ready to call in, and Brady and I will give you the phone number in just a little bit. Dr. Paster joins us from his clinic in Oregon. Hi, Zorba. Good to see you.
Good to see you guys.
Big weekend ahead.
Yes.
Especially the Badger game tomorrow. You know, so many people are so excited that football is back at Camp Randall. We're kind of forgetting that we're still in the middle of a pandemic. So if you're going to the game, what is it that you want people to be thinking about?
Well, first of all, you've got to realize we're in the middle of a pandemic, like you said. Even if you're immunized, there's a small risk, very small risk, but a small risk you may get seriously ill. And if you're going to be around thousands of people, chances are one of them is going to have COVID that you may go through. So I think if you're anxious, and many people are, you wear a mask until you get to your seat. When you get to your seat, of course, you still have people around you, but your biggest risk is walking from the beginning of where you drive your car or go your car all the way to your seat. That's when you're going to pass thousands of people, and that's when you are at risk. Even though it's outside, the risk is much less, but think about it. You're going through the stadium inside on the way to get outside, and you're next to people. That's where that risk occurs.
So the masks are not required outside when you're in the stadium outside watching the game, but they're highly recommended because, as you know, Camp Randall is pretty densely packed. If you were going to the game, would you wear your mask during the game?
I would wear a mask during the game. That's what I would do. Now, if I'm excited and I really want to scream, I might take off my mask for part of the game because I just lost it and I'm screaming, but still, I may wear the mask for 90% of the game. I don't think of it as 100% or zero. Let's think of it as when should I wear the mask and what reduces my risk. And I think, especially if you've got diabetes, hypertension, if you're an older guy like I am, and other things, just reduce your risk. And of course, if you're totally fearful, you can't go to the game. But frankly, if I had tickets, I might go to the game tomorrow and I would just mask up 95% of the time. But believe me, if we win big, I'm going to take my mask off probably and scream like everybody else. And there's my risk.
And let the chips fall where they may.
Yeah, that's where it goes.
Oh, there's a lot to talk about. We want you to call in now to ask your questions to Dr. Zorba Paster. He'll join us again after the break. The number is 270-9933.
Zorba, stand by. We'll be right back with your calls in just a second.
Get the biggest appliance savings at the big sale going on now at all Grand Appliance showrooms. Get this Amana top-load washer for just $4.98. This Frigidaire smooth top range for just $5.98. Or bundle up and save even more with up to $1,000 in extra savings available exclusively at Grand Appliance. Don't miss the big sale at grandappliance.com or your local Grand showroom. Grand Appliance, the appliance experts since 1930.
To be a thriver with metastatic breast cancer means asking for what we want and need, and we need more time. So we want Kisqali. Living longer is possible and proven with Kisqali when taken with a non-steroidal aromatase inhibitor in premenopausal women with HR-positive, HER2-negative metastatic breast cancer. Kisqali is a pill that's significantly more effective at delaying disease progression versus a non-steroidal aromatase inhibitor alone. Kisqali can cause lung problems or an abnormal heartbeat, which can lead to death. It can cause serious skin reactions, liver problems, and low white blood cell counts that may result in severe infections. Tell your doctor right away if you have new or worsening symptoms, including breathing problems, cough, chest pain, a change in your heartbeat, dizziness, yellowing of the skin or eyes, dark urine, tiredness, loss of appetite, abdomen pain, bleeding, bruising, fever, chills, or other symptoms of an infection, a severe or worsening rash, are or plan to become pregnant or breastfeeding. Avoid grapefruit during treatment. Kisqali is not approved for use with tamoxifen. Ask your doctor about living longer with Kisqali.
Madison Magazine's Fall Restaurant Week 2021 is here. Participating restaurants will provide a 3-course lunch starting at $15 and a 3-course dinner starting at $25, featuring wine and more. Don't miss Madison Magazine's Fall Restaurant Week 2021, starting September 19th through the 24th. For participating restaurant menus and details, visit MadisonRestaurantWeek.com. Presenting sponsor, the Keep Wisconsin Warm Cool Fund. Supporting sponsor, E&J Gallo Winery.
At Pick and Save, we take scrutinizing freshness to a whole new level, where only the best of the best of the best will do. But just because you can't get any higher than perfect 10 produce, that doesn't mean that we won't try. Because Pick and Save produce isn't just fresh, it's fresher than fresh. Pick and Save, fresh for everyone.
Whether you have a design emergency or you just want to shop the best furniture showroom in town, you need Dwellings, Madison's best kept secret for design and furniture. Shop our fabulous showroom, Hard Rock Road, Fitchburg.
Hello and welcome back. A few troubled spots that we're looking at here this afternoon. Definitely right along the belt line. We are seeing quite a bit of some slowdown areas. And again, most of that is just because we are seeing the rainfall and people are taking it a little bit slower, as they should. Also, I-39 around Janesville. That's also quite slow right now, but no reported accidents. So that's some good news there. But again, there is quite a bit of rainfall out there, so take it slow on the roadways here today.
Thanks, Austin. Dr. Zorba Paster joins us today for his weekly visit. Let's get right to your calls. We have Valerie from Madison. Valerie, what's your question?
If I received a Moderna vaccine for my first 2 vaccines, would it be okay to go with the other one for the booster?
Oh, sure. Well, that, by the way, is an excellent question. It turns out you can mix and match the messenger RNA boosters. So if you got a Pfizer, you can get the Moderna as a booster. If you got the Moderna, you can get the Pfizer as the booster. And in the UK, they actually think mixing and matching might actually be a better idea. But according to Dr. Fauci and others, you can definitely mix, no problem at all. So, and Moderna, by the way, are now in a lot of doctors' offices, like our office. And the reason is we don't need that super cold freezer that you need for Pfizer. And so many of the doctors' offices have Moderna. They're actually giving Moderna for the initial immunization. And once we're allowed to give boosters, I bet a lot of the doctors will be giving boosters in their office. And certainly pharmacies will be doing that too.
All right, let's go to Linda in Janesville. Hi, Linda. What's your question?
Yes, I got a negative test today, but I was around somebody that tested positive last week. That's why I got the test. And my doctor said, his nurse said that it's okay now to be around my grandkids and I can travel if I wear a mask for 14 days. Why does CDC say that you should self-quarantine for 14 days?
Well, there are a couple of things. So first of all, you had a negative test 5 days after you actually had contact. That's about the time the test is assuredly most likely going to be positive. But still, there is a false negative rate. So in other words, the CDC says if you're in really close contact in the same room, very close and right with them all the time, that you can't be assured that you are not negative. So you have to look and decide for yourself what you're going to do. A negative test doesn't mean you're negative. It means you are probably negative, and unfortunately, that's where the gray zone is.
Thank you, Linda. Let's go to Catherine from Madison. Catherine, what do you want to know?
Hi. My question involves in the beginning, they didn't want you to have a vaccine for 14 days before you got the COVID vaccine. And now they're talking about getting the flu shot and the vaccine at the same time. What has changed, and is it safe?
Well, first of all, in terms of the booster, I haven't seen the CDC outlines on whether or not you can give the flu shot and the booster together. It also depends on which vaccine you're actually getting. So I haven't seen what the CDC is recommending in terms of the flu shot and the vaccine, and whether or not they actually can be given on the same day. So right now, I'm going to defer that until I look that up and see what the CDC says.
And the boosters are not available generally until September 20th.
The boosters are only available for people who have autoimmune diseases, and that's a different issue.
Can you get a flu shot right now?
I think the flu shots are just available, but we're not giving them in our office, so I don't know if they're available at Walgreens or CVS at this time.
But if they come 8 months after your last shot, that puts me in December.
Well,
so I would be getting a flu shot by that time.
Right. It's a matter of whether or not we give 2 immunizations at the same time. Some immunizations we can give at the same time, and some we can't. And it's really a function of the immunization. So, for instance, for children, we are now giving 3 or 4 immunizations at the same time. So let's wait for CDC guidance to see exactly what happens with the COVID booster and with the influenza shot. Right now, they have not made a statement because the COVID booster is not approved except for a small group of people with autoimmune diseases and a few other issues.
Okay, right.
Thank you for your question. Up next, we have Charles from Wanakee. Hey, Charles.
Hey, how are you? Thank you for taking the time.
Sure.
Doctor, a quick question for you. This morning they're talking about how the Pfizer does not have the same amount of antibodies as Moderna, and as we talk about the boosters and everything else, one, is it even plausible to be able to change over to Moderna for a booster, or is that not even in the realm of possibility?
Well, first of all, you can change over for the booster, but the real issue is not the amount of antibodies. The issue is whether or not you get sick. And right now, the Pfizer shot and the Moderna shot seem to be exactly as effective. Remember, we don't know what the minimum number of antibodies are in order to keep you safe. So we don't know what that magic number is. And that initial research shows there may be more with the Moderna, but that doesn't mean that both shots are not equally effective. And right now, the CDC and the FDA say Pfizer and Moderna have an equal effectivity rate. And we look at the number of people in the hospital. 98.5% of those people in the hospital are not immunized. And that means we're looking at a pandemic of the unimmunized. And if you know of somebody who has not been immunized, gently, and I mean gently, talk to them and try to convince them to get immunized, because that's the way we're going to get this under control, by getting everyone immunized. And there are still too many people who are worried about the immunization. Well, we now know hundreds of millions of shots have gotten out. They are incredibly safe vaccines, safer than many other vaccines that we have ever given and gotten in our lifetime.
All right, Zorba, thank you so much for your time. We appreciate it. Thanks for your calls, everybody. We're out of time this afternoon, but we will do this again very soon. We have Zorba on once a week. Yell loud, Zorba, when those Badgers score.
I will. Go Badgers.
All right, thanks so much. Have a great weekend, and we'll be right back.